treatments can I have for varicose veins? Varicose veins cause symptoms such as pain, swelling, itching, skin discoloration, bleeding, or ulcers. If your veins are causing problems, there is good evidence to suggest treatment will help. This video gives a brief introduction to the treatments available. Once your blood has delivered nutrients to your leg, it travels first into small veins called tributaries. Like a river network, these become larger until they join the main superficial vein. The varicose veins we see are swollen in large tributaries, which then join a diseased superficial vein which you cannot see. Most varicose veins are caused by failing valves. Blood travels in the wrong direction, increasing pressure. Treatment aims to permanently block or remove diseased veins, allowing blood to flow through other healthy veins. Modern treatments have replaced surgical stripping and revolutionized care, allowing this to be done through small punches under local anesthetic with a rapid recovery. First, we treat the main superficial vein. Based on the evidence, endothermal ablation is the best treatment for most people. This uses radiofrequency or laser energy to seal the vein closed using heat. A tiny device is placed in the vein through a needle using ultrasound to see where it is. Anesthetic medication is injected around the vein to protect the surrounding tissues. You might experience some discomfort during this stage, but no pain while the vein is being sealed. Next, we move on to the varicose veins. There are two main options here. We can, after injecting anesthetic, then remove these veins through tiny punches in the leg. This is called phlebectomy. Following this treatment, the varicose vein will be gone. The second option is ultrasound-guided foam sclerotherapy. This involves injecting a medication into each varicose vein to seal it. You may need repeated treatment to close the vein or to remove clotted blood from it. Foam sclerotherapy can also be used to seal the superficial vein as well, instead of heat. However, the evidence suggests this is less effective and may need to be repeated. Some options allow both your main vein and tributaries to be treated all at the same time, whereas others will require multiple treatments. Each treatment takes around an hour, and you will be able to walk in and walk out. Most people are back to normal within a day or two. Treatment for varicose veins has been shown to be a highly effective way to reduce your symptoms and improve your quality of life. Data shows benefits out to 10 years and beyond. Speak to your doctor about treatment and let your surgeon know what is important to you. You might want to use the NHS Decision Support Tool. For more information about varicose veins and venous disease, watch the video "Why Do My Legs Hurt?" on our YouTube channel.